The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors.
Welcome to the wonderful world of wellness with Dr. Andy Mencia. This medical program heard from 7 to 7:30 each Saturday right here on WSBR 740 AM is brought to you by the Adult and Geriatric Center under the medical direction of geriatrician Dr. Andy Mencia. All right, well, we have a roaring time here today. Dr. Andy Mencia, of course.
Good morning.
Good morning.
How are we doing?
Yes, we're not giving your phone number out yet. You don't have to do that.
No,
not yet. But he brought this gorgeous physician with him.
Only the best.
Yeah,
Only
right.
the
I'm
best.
just I got to figure this all out. But it's Dr. Stephen Svabek. And Svabek, is that
That's correct. Thank you, Anita.
Did I do that right?
You did.
Okay.
Thank God it's radio, because gorgeous would be a different description, I think.
Oh my gosh! The outside, the sunrise has just started.
Because
Happened.
Steven came in.
I guess so. This is gorgeous.
Because
Okay.
Spayback is bringing
Spayback.
bringing life to South Florida.
So, Dr. Mencia, you're always looking for brilliant physicians and persons to help you at your center. And now you brought someone who's really high-powered. Why don't you tell everybody about him?
Well, one of the most exciting thing is when I tell my patient that I have a person that is not only a orthopedic that can do any type of orthopedic surgery, but just like I did internal medicine and then I did my fellowship in geriatric medicine, he did his training as a general orthopedic surgeon, but then he did a fellowship on spine surgery. And Stephen, why don't you tell us about the fellowship? What does it entail?
Well, let me ask you a question, Dr. Svabek.
Be gentle with me, Anita.
Yeah, I'm going to be gentle. Oh, yeah, that's
my first time,
my
as you
young
can tell.
age. I mean, you really got to be gentle. That's good. When people are having problems and they're older, and you talk about orthopedics, we always think of their knees and their hips.
Correct.
And now we're talking about their spine. Is it normal for a spine to deteriorate?
Sure. It's no different than any other joint, and Dr. Mencia knows that probably 50% of people that come to see him, whether it's geriatric or even the young population, is because of a back pain issue of some sort. And just like a knee joint, the spine has a synovial joint, and those are called the facet or facet joints that have a synovial lining. And of course, as they become aged and deteriorated, they become hypertrophied, which is a big word meaning thickened and enlarged. And along with ligaments and other structures in the spine, they begin to narrow the spine. And so you see people walking more in a flexed position or forward bent position with their walkers because their spine has become narrowed, and that condition is called spinal stenosis.
Okay, so Dr. Mencia, when you're seeing your patients, are you noticing that their body really, they may be very healthy in a sense, but yet you see things happening to their body, they're kind of leaning over, and it's just a natural evolution?
Well, not natural. We want to keep the person as erect as possible. And it's like flying a plane and you're going from point A to point B. If you divert from your path, you're going to end up really far away from where you want to be. So when you have a spine problem, the spine is like the main core of your posture. So when you have a spine problem, it can not only reflect as back pain, it can reflect as leg problem. And you get a lot of patients, for example, you sprain your ankle, you start favoring the other leg. And when you do that, you put pressure on one side of your spine more than the other, you can start twisting your spine. And it can become a chronic problem. So in the center, what we try to do, now that we have Dr. Spayback with us, is to minimize those long-lasting problems from the back. Try to tackle them early. so that we don't end up with hip problem and knee problem and ankle problem. You can have all sorts. One of the patients that had been scheduled to see Dr. Spavek, I asked him, when did your problem start? He said, I started having numbness on the side of my leg.
They call that sciatic nerve, or is that, no, it's different?
Well, not just numbness, no pain.
Numbness.
The sciatic
Peripheral.
pain is more like a pain that radiates
Right.
down to your buttocks or
Right.
down to your leg and what have you. So the numbness, and then he started getting more of a pain on that side of the leg. And then when I look at his back was all twisted. And I asked him, I said, were you having any back problem? He said, no, not really. I said, well, are you going to do an x-ray of my hip? I said, no, let's wait for Dr. Spavek to see you. But I think, the root of your problem is on your back.
Amazing.
So we get your back straightened out, you're going to be able to solve your problems. And Dr. Spavek, why don't you talk to us about the complications of back problems, such as people that end up prematurely on wheelchair or prematurely with a walker?
Sure. Dr. Mencia, the biggest problem is, as you know, is convincing people that their condition, which has become mechanical and structural, versus a muscular problem, needs to be fixed. Everyone hears spine surgery and panics. How many times do you hear and I hear, oh, don't have spine surgery because it never gets better after that? And of course, I always tell patients, you're standing in Walmart and you're getting ready to check out. No one ever turns around to you and says, hey, do you know why I'm standing so straight and happy? Because I had spine surgery and was successful. We never hear about anything good, just like in politics and the country and things going on. There's a lot of problems going on, but we never hear about the good stories. Well, most people are going to tell you about the stories that didn't work for them. And I always say the reason why is that you have a condition, and if it has to be treated surgically, as long as it's done for the right reasons, it's generally very successful. So as you said, this patient we're getting ready to see, not only do they have maybe stenosis, but now they have curvature of the spine, and as you get older, gravity wins, as we all know. No one can beat gravity, so as we try to instruct and you keep their cores healthy, and by doing that, their weight down, then they can develop a scoliosis. And so sometimes it's not just so much trying to straighten that older scoliotic spine or curved spine. Now it's just a matter of if their nerve roots have become compressed because of their deformity, and they haven't done well with therapy, and we've tried some injections, because we always want to try conservative care first. And that's what I think is the key, is you develop a relationship with you or with your surgeon or with anybody that's in your center, and you become comfortable and you trust them, because we just don't always rush into what people think as a surgical problem. Most people, 90%, do get better conservatively through therapy and injections. And when they don't, then it's time to discuss a surgical correction for them. And with all the technology we have today, the large incisions and major surgeries that people had in the past that they still are visibly can see, their friends, we now do things through smaller incisions and much smaller ways to do it, called minimally invasive procedures.
In robots?
No, we haven't gotten there yet, and
No, that's
Anita, don't
fine.
take our job from us.
I can't take your time
Listen,
yet.
there'll be a robotic person one day in your chair, and you're going to be very unhappy.
Oh, I'm sure I will. Listen, I'm a robot most of the time anyway.
But
No,
with
wait.
those small surgery, the recuperation time is amazing, right?
Absolutely.
Is that called laparoscopic when you do it that way?
No,
or still not the
there
same?
are some endoscopic procedures being
Endoscopic.
done. They're really not as prevalent as people think, and they do have higher complication rates. Although in the right hands, I'm sure some people get great results. But what Dr. Mencia is referring to is that you can do some incisions now and put some small little tubes and less muscle stripping. We've learned that taking and stripping the muscles off the bone develops inflammatory change in the muscle, and when they go to heal, unfortunately, bone and muscle interface can't heal normally once you've taken away God's anatomy. Now they become fibrosed or scarred, and it's that scar tissue sometimes that leads to issues or weakness that take a long time to get better with therapy. But and then sometimes it is time for traditional old-time surgery, since I guess we're not old, but we're We watch things pass us by as new things develop, but sometimes the traditional old surgeries are still the best way to treat it.
Well, Dr. Mencia is very big on exercise, taekwondo, a lot of things. Do you think that someone does yoga and they do their walking and they continue to keep their body, in good shape, that they maybe will never have those kinds of problems?
Both way. If you are active on exercise, especially weight-bearing exercise, the best thing to keep your bone intact and prevent osteoporosis. And by moving the joint, you can prevent the arthritic changes of the joint because you're keeping the fluid between those facets in the joint. Now, if you go and train too hard, or you have a trainer that he or she does not know what they are doing, they can hurt you. And I have many patients that have come to me with back problem, where the back is twisted, and they are unable to work or anything like that because they were doing yoga and they were doing this position, and the instructor kept pushing and pushing, and the muscle pull in place, and they go into this huge spasm. And you see their back completely twisted. They all come into the office suffering. And now that we have Dr. Spavek with us, it's like having the dental department. You never see dentists out there that they have a psychologist, they have a neurologist, they have a medical doctor, they have a lab, they have ultrasound. So Dr. Spavek, being a orthopedic and being a fellowship-trained back specialist, this is going to be probably one of the first center in back surgery that will have you don't have to see the neurologist or me before you see Dr. Spavek. You can call the office, you can set up an appointment directly with him and become his patient. At the center, he has to his disposal the neurologist and the psychologist and the lab work and the ultrasound, because sometimes when we do the injection, we do the ultrasound guided injection when we need to treat the patient on the spot. And if it's something major, then he's on staff with all the major hospitals. He can take the patient
Fantastic.
to the best of the best.
We have to be as a big celebration for this. Now it's time for me to give the phone number. It's 954-489-1345.
1608.
I think he really wants to be. Give up being a doctor. I think you're going to be a talk show host here. Between the two of you, I'm leaving. I'll be the doctor. You be this. Okay.
You can do that any day you want.
Okay, sure.
We'll gladly hand that ring to you.
489-1345, and they are located at 1608 East Commercial Boulevard in Fort Lauderdale. It's really just a little bit west of Holy Cross Hospital. And if you go on their website, you'll be able to hear a lot of Dr. Mencia's radio shows right here with that he's been doing on WSBR and WNN. As a matter of fact, we are simulcast, so if someone's on WNN 1470 AM, you're still hearing the WSBR 740 AM. It's geriatrics.tv. Well, it seems like this is going to be a match made in heaven, because I'm sure when patients, the one thing that's been very nice is that I know as a gerontologist, I know the one thing that people don't want to do is to go from this doctor to the other doctor, get somebody to drive them, wait for them. I mean, they're spending all week going to different doctors, where you can go at one time to Dr. Mencia's office, where they're very friendly, which isn't always the case with every other office, and have everything done. The appointments are right there. That was your whole idea, wasn't it?
That was the idea, because when I hear from my patients about going to another office, and I ask, why you don't want to go? It's a great, surgeon. I'm going to no, because a new secretary, a new this. You have to break the ice every time. It's not only dealing with the doctor that you're going to see, but the staff. And God forbid, sometimes the doctor is excellent, but the staff is horrible. And, they can break your practice. So
I have a question for you. When I come then, and of course I am Dr. Mencia's patient, but when I come, you fill out one form, and whether you're going to see Dr. Spavek or you're going to see the dentist, One form, right?
One form.
You know,
Everything
every
is in the
time you
computer.
go to do it's another form you have to
All
fill
the-
out every doctor.
When Dr. Spebeck is going to see you, or I see his report, it's the same computer, it's the same chart. So we are all
Lovely.
working on the same chart, and it improved the quality of care. A lot of people don't want to have anything done to their back, especially with the scare going on with meningitis that had been associated with people getting needle in their back. And when people put a needle in the back, it could be somebody just like me that is an internist that had done a few procedures and put a needle in the back. It could be a person that did family medicine or internal medicine or just a general practitioner and is not getting enough patient and decided to do now pain management, and is not a person that is fellowship trained in pain management. So even though I know a lot of orthopedic doctors, to bring Dr. Spavek to the practice, I am confident that I'm bringing somebody that, just like I am fellowship trained in geriatric medicine, he is fellowship trained in spine. So when I put my patient in his hand, I know they are in good hands. And the same thing for the community out there. Sometimes people, they don't know, should I go and see a neurosurgeon or an orthopedic to touch me, or should I just go to pain management? Medicine now is so advanced that we have people now specializing, doing fellowship, which means that, and Dr. Spavek, you can elaborate a little bit more on this. When I finished my internal medicine, I finished my training, I became a chief resident. Then I did 2 years just doing geriatric medicine, waking up and going to sleep, and it was all geriatric medicine. How's your training on spine?
No, wait, before you answer that, I want to know, I always ask this of every doctor, why did you get into this particular specialty?
It's pretty
Good
easy,
question.
I think, on our end. Most, of course, they always think of the orthopedic surgeons as the jocks, and a lot of us were. I played football.
Not sex, but jocks. We're getting there. We're moving there, right?
Jock straps. So I did play football at University of Kansas.
Yeah, I could tell.
And,
You got the body for it.
My team physician was my mentor, and a
Really?
great man. It must be in the Spanish blood, but his name was Bill Garcia, and he was a Chilean, and he became my friend, and he guided me through, and he was probably the reason why I became an orthopedic surgeon. I did, actually, my first love was OBGYN, but it just didn't work out. But that's fine.
Well, this is actually a lot harder.
They're both hard. Anything's hard in medicine anymore because you're dealing with so many different problems, and we're living longer. And so all of you and all of us who are living longer, you expect us in some way to keep you able to do what you like to do when you were 20. And then it's hard for us to say you're not 20 anymore, because we're not 20 either anymore.
Well, as Dr. Mencia just asked you, then I know I interrupt you. Tell me about your training. What does it really require? I mean, do you practice on cadavers?
Well, we all do. Thank God.
But on the
Even with new procedures, you always try to go take a course and then hone your skills on someone who's dead first. It's much easier. There's not a lot of blood loss, and it keeps the lawsuits down, obviously. But anyway, I do general orthopedic surgery as well as spine, and so.
Meaning
that if sometimes
hips
your
and
back
knees?
pain is associated with an arthritic hip, and if you don't look at that and don't fix their hip first, sometimes their back isn't the issue, or they have both. And you can't rehab after a surgical back problem very well if you can't be mobile on your hip. So you sometimes have to replace the hip and then take care of the spine problem. So, or knees, it's that song, the hip bones connected to that old song.
There really is a song that means I bet a doctor wrote that song.
They're really not that all connected, but they are. So you do general orthopedic surgery residency. Actually, you do a year of general surgery, and then you do 5 years of orthopedics. So 4 to 5 years of orthopedics, including some research and some programs, which I did a 5-year program, including a year of general surgery. Then 4 years of orthopedic, and everyone does that chief year where you kind of run the show and you're in charge and learn how to hone your skills, as well as learn how to delegate work, and more importantly learn how to teach people. as you've been taught. And then if you want to go out and work, you can. And then some people decide to specialize, and that's where I did an extra year of spine, where, like Dr. Mencia said, eat, drink, and sleep spine. That's all you do. And you do a research project. Usually, most programs that make you get involved in research and produce a paper during that program, or as the program goes on, you finish out the paper and research. So we obviously, by the time we get to where Dr. Mencia and I are, you've had a lot of reading, a lot of experience, a lot of cases, and then you get the most terrifying time of your life when the knife hits your hand and the patient comes to Dr. Mencia, and he actually has to see a patient without anyone standing over him and make a diagnosis and hope to God he's right, because if he's not, there's no one that's going to take the brunt for that problem anymore to see. It's all his, just like it's all mine. And
I have to give
and
the phone.
that knee scope that took you a half hour as a resident takes you 2 hours the first time. You're like, what happened? Why was it 2
great.
hours?
I love your honesty. You're fun. I can see you're a great doctor. Because half the thing that people should realize, it's great to be a great doctor, but you have to be able to talk to your patients too. And it sounds like you can do that. The phone number to call if you now are having problems and you didn't know where to go, now we know where to recommend you go. 954-489-1345. That's Dr. Andy Mencia. It's called the Adult and Geriatric Medical Center. And we're so happy that you did find yourself a winner. I have a lot of experience in what you're talking. My husband, who is 88, he's had 4 hips and he has 2 new knees. He's fantastic. I mean, you can't keep up with him. It really works.
Yes, it does.
If you have a good surgeon, it really works. If you have a good patient, it works too, because the patients have to do the right thing,
It really
right?
is more about the patient and actually the post-op. We trust a lot of people. We're very skilled and we're dedicated, and we all feel we're very good at what we do. As there are a lot of people around us very good at what they do, but it's really the post-operative care. Your physician who's watching your diet, because there's diabetes involved in this. If you don't control your sugars, they can affect your healing process. So I've got my man sitting right next to me who will take care of that and control their sugars before and after. Then we have therapy. Very important to go to that therapy and do it. So there's a lot of people that play. We always are happy to get the smiles and thank you for the life becoming better. But, the real good physician knows that there was a lot of other people behind that whole thing that made the success story what it is, including what Dr. Mencia said. Just the greeting at the door the first time, the comfort level you have when you have a staff that likes, okay, I'm not going to be blown off. I'm going to get care. I'm going to have my questions answered. That starts right when you walk in the door. And so they all makes everybody's job easier. And it's a total care. That's what he's building, and that's why I joined him and I believe in what he's doing.
Yeah, I'm glad you did. Well, this almost completes your having your own little medical school here. With everybody.
We do have
the IRS will show up then.
Yeah. We do have the student that do rotate with us, and so it becoming a teaching institution.
No, it's really wonderful.
State of the art.
What I really wanted to move along with this, with the orthopedics now that you have, what would really come first? So let's say someone is having a problem, and you said they could just call and go directly to him, but I think that sometimes there are people who think they're having problems, and they're not really, it just hurts, but as you said, it's for other reasons, maybe.
Exactly.
Even
if
depression, right?
If, let's say, you're trying to raise your arm to reach the cabinet, and that arm, you need to help the arm go up, or you see that you're having problem, don't let that problem linger for a long time. You can call in and set up an appointment, and Dr. Spavek will look at your entire body. He's not, because he's an orthopedic surgeon, he can look at your wrist. I have a patient that is coming over to see him because he fell down, and he's having pain on the wrist and the ankle, nothing to do with the spine. But having him look at those conditions, he's trained on the spine. He can say how that hip can affect my spine on that patient, so that let me prevent this person from having a significant problem. And I tell my patient, when they're having a knee problem, and we linger with that problem for a long time, that knee problem is going to force you to favor your opposite leg, And when you do favor a leg more than the other one, you're going to twist your spine. And it's going to be a long process, and anything that you do over a long process, over a long period of time, it takes more to fix. That's when something acute happens, something sudden happening to you. So to me, it's a blessing to have Dr. Spavek with us at the practice. And he's also out west. So for those patients that need to see him out west, he can see in our office out west in Margate, and the patient can come to the center also and see him at the center. So it's a win-win for both of us.
I always liked, and I know we have only about 2 or 3 minutes left, but let me ask.
No.
Sorry.
That's it?
Yeah.
I got up for a half hour?
Listen, usually 5 minutes is what. Okay. I do have to ask you a question. I do a lot of cutting edge things, and it seems that X-rays, other than it being they're produced quickly, they're almost the same now. I mean, is there anything that can happen for an X-ray? When can we start putting something on like this and they'll it's not. It's still the same thing. You think there'll be any progress in that?
You never know. I mean, what they have done in X-ray today is, of course, gone to what they call this PACS system, where actually instead of a hard copy, it can go right to a computer, and anybody and everywhere, if they can get in and have the codes, can see something. I mean, even if I get called to the emergency room today, I can be linked to the emergency room where I can actually, instead of relying on an emergency room physician, which are usually very good about describing what you have, you can just see it now in your home.
That's fabulous.
So that change is coming. So I'm sure
That's
with
good.
that and the advances we're having, and still see one day there might be a way to do a mobile something Star Wars thing.
You take your phone, you go like this.
I hope I'm not around when that happens. It's hard enough to keep up with this stuff as it is.
Well, so what happens when you need an orthopedic surgeon? What are you going to do? Have Dr. Mencia come in?
He's going to train me.
Yeah, I'll have him pray over me and put some holy water on me.
No, do your taekwondo.
I'll go there first.
You know that he's a big taekwondo guy.
Oh,
Okay.
Yeah. The reason why is he knows the core.
Yeah.
Yeah.
He does.
If your abdominal muscles and your paraspinal muscles are in great shape, you really are going to have very few spine problems. And so that's why he's good at what he does.
That's the next thing. You've got to have classes in taekwondo.
Unfortunately,
Yes.
it means I'm not busy sometimes.
No. We're going to keep you busy.
But then
Unfortunately, you'll
you
be
can
busy.
always fall and break something, which will fill that in.
We'll
when
teach you how to cook. They need a lot of food over there.
Sure.
We'll do some.
I make great reservations. That's what I'm good at.
Well, it's been terrific. I really thank you, and I'm going to take a picture of you myself because people will not believe you. I mean, they won't believe how cute he is, and how they're going to come here just to look at the beautiful women you've brought in, the beautiful men. I mean,
I'm glad it's radio. That's all I have to say.
No. People trust me. Anyway, thank you very much for coming, and Dr. Mencia, we appreciate you always. And the phone number. Would you like to give your own phone number? You have so much fun with that.
954-489-1345.
Don't forget, give it in Spanish. Don't forget.
Not yet. 954-489-1345. But do go to their website, geriatrics.tv.
We are open on Saturday.
Oh, open on Saturday.
We have the flu shot.
I know. And everything happens to me after this show. I don't get down there to get my flu shot, but I've got to. I got to get my 2 flu shots.
And Dr. Spavek is already on board with us.
Does he know how to give flu shots?
No, we do that
Oh,
for
okay.
him.
I'm sorry.
Yeah, we do that for him.
I can't do everything, Anita. I can't do everything,
You said
Anita.
you wanted to be a gynecologist.
Yeah.
You're doing that?
I can't do everything, Anita. One thing at a time.
Okay, one thing at a time. Okay, thank you very much.
I think he's going to be busy enough just with this field.
He will, unfortunately. That's okay. Well, thank you very much. And we'll be back. Joe Karp is waiting for us, and our elder law attorney will be speaking with him shortly.
The opinions expressed on the preceding sponsored program were strictly those of its hosts, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors.
Shin bone, knee bone, bone, your viable negative. Hip bone negative. Backbone, your backbone negative. Shoulder bone negative. Neck bone, your neck bone negative. Hip bone, now hear the word of the Lord. Hip bones, hip bones, hip bones.
It's smart to be smart about your medical health. It's coming. The Cure Symposium, South Florida's first medical and bioscience symposium. Don't miss hearing 36 physicians and scientists